For millions of women, managing conditions like endometriosis, PCOS, or severe PMS means waking up to intense biological friction, the kind of daily radiating pelvic pain and hormonal fatigue that makes you grip the edge of the sink just to get through the morning. The standard medical approach to managing these symptoms relies heavily on pharmacology. We reach for the birth control dispenser, NSAIDs, or metformin to suppress the symptoms and force the body into a manageable baseline. Contrasting that heavy pharmaceutical reliance is a practice with over 5,000 years of history. Yoga is increasingly recognized by the medical community as a potent, non-pharmacological therapy for gynecological health. But here is the dilemma. The modern wellness industry markets yoga as a universal, one-size-fits-all cure. Patients with complex endocrine or pelvic issues often drop into a generic local class, expecting medical results from a generalized workout. That generic approach is actively counterproductive. Pushing through an intense, heat-building vinyasa flow during an acute endometriosis flare-up doesn't heal you. It increases pelvic inflammation and leaves you frustrated. Yoga is a clinical tool. It only yields physiological results when the physical input, the style, intensity, and timing, corresponds exactly to the underlying biological pathology. This comparison matrix maps standard medical interventions on the left against targeted yoga protocols on the right. Looking at the third column, you can see the stark trade-off. Pills offer instant, low-effort relief, but come with chemical side effects. Yoga avoids those side effects, but exacts a massive daily behavioral time tax. It is also strictly an adjunct therapy. It works alongside your conventional medical care to reduce your reliance on medication. It does not replace the professional treatment of a diagnosed condition. To make this work, we have to build a protocol map. We need to match your specific diagnosis to the exact type, duration, and frequency of practice required to see actual clinical outcomes. Treating yoga like a random weekly hobby guarantees failure. Approaching it as a prescribed daily medical adjunct drives measurable, systemic physiological changes. Our symptom-to-mat decision tree starts at your primary symptom. Branching first into acute pain, the required input for dysmenorrhea or endometriosis is 10 to 20 minutes of restorative poses, like reclining butterfly, practiced daily during your period. The biological mechanism is direct. These hip-opening poses improve blood circulation to ischemic pelvic tissues and activate the parasympathetic nervous system, pulling your body out of a localized stress response. The clinical outcome for this pathway is significant, acute pain relief. Clinical trials show patients using this protocol measurably reduce their dependence on NSAIDs. Moving to the related issue of pelvic floor dysfunction, like urinary incontinence. Here, the practice shifts away from macro movements entirely, focusing instead on deep internal micro engagements. The required input is a 12-week pelvic floor program centered on Mula Bandha, or root lock, isolating and strengthening the muscular hammock at the base of the pelvis. The leverage here is immense. Research shows this exact 12-week protocol yields a 60% reduction in daily incontinence episodes. For pain and pelvic strength, you don't need intense exertion. You need strict anatomical precision and exact cycle timing to mitigate the symptoms. Resetting our flowchart, we target systemic endocrine imbalances like PCOS and severe PMS.
The required input is grueling: 45 minutes of dynamic practice, 5 days a week. This intense routine must be maintained for a strict 6-month minimum before seeing physiological results. If you sustain that effort, the biological outcomes are significant. Patients demonstrate improved insulin sensitivity, steady weight reduction, and normalized ovarian morphology on ultrasounds. This exact high-frequency active approach also aggressively drives down the severity of both the physical and emotional symptoms of PMS during your luteal phase. For metabolic optimization, this is a marathon. The massive time investment is the mandatory price you pay to rebalance your endocrine system. Our final branch focuses on patients enduring major hormonal transitions, specifically menopause and the high-stakes reality of clinical fertility treatments like IVF. We need to clear away the wellness hype. The clinical data shows that yoga has very weak direct efficacy for stopping menopausal hot flashes. Where it actually excels during menopause and IVF is serving as a profound buffer against extreme psychological and physiological stress. The protocol here requires zero physical exertion. It is yoga nidra, guided yogic sleep, practiced 3 to 5 times a week for 30 minutes. This line graph shows the impact of that deep relaxation protocol over 6 months. We see a steady, measurable decline in cortisol, prolactin, and anxiety scores. The hidden tax? It requires immense mental discipline to lie perfectly still in guided relaxation, a state many highly stressed patients actively resist. For complex fertility or menopausal journeys, you use this practice as a mandatory nervous system reset. It protects your body's chemistry from the compounding damage of chronic stress. To maintain these intense protocols without burning out, you have to sync your practice intensity to the 4 phases of your 28-day menstrual cycle. The rule is simple: enforced rest and gentle restorative poses during menstruation, and push for vigorous dynamic flows during your ovulation energy peak. To evaluate if this is worth your time, we can plot these protocols on this quadrant chart, measuring the daily effort required against the time it takes to see an impact. Menstrual cramp relief plots in the bottom left. It demands very low physical effort and delivers fast, acute impact. PCOS hormonal regulation sits in the top right quadrant. It requires high daily effort, and the systemic impact is slow to materialize. Yoga Nidra for IVF stress plots in the bottom right. The physical effort is low, but the requirement for consistent mental discipline over a long period is high. Accurately mapping your condition on this matrix is the only way to set realistic expectations. If you know the cost up front, you will actually stay on the mat long enough to see the benefits. If you are looking for an overnight cure for a complex endocrine disorder, or if you are managing an acute surgical issue without your doctor's supervision, this path is not for you. Yoga is completely ineffective as a blanket prescription. It is a highly specific dosage of movement, stillness, and breath. The ideal candidate for this practice understands that lasting biological change requires daily, consistent inputs. You choose to trade the immediate gratification of the pill for sustainable, long-term biological autonomy. When treated as a non-negotiable 15 to 40-minute daily medical adjunct, yoga functions as a high-precision tool for